Is Arpan Banerjee. I'm a doctoral fellow at the Department of East Asian Studies, University of Delhi, and academic counselor here at IGNOU. And I have been teaching you the paper Social Policies and Administration. And the code of this paper is BPAE 144. So I welcome you all to today's learning session. So let us begin today's class. So let us see what we have done in this paper so far. So far in this paper, we have discussed the first block that is pertaining to social policy and administration and introduction that we have discussed. It consisted of the unit 1, which was social policy, concept, characteristics, objectives, scope, functions, principles, and models. The unit 2 was pertaining to social policy and administration. The second block of this paper, which we have already discussed, was pertaining to social policies and sustainable development goals in the social sector. So in this block, we have discussed the first 3 units, that is Unit 3, poverty alleviation, Unit 4, food security, and Unit 5, that is education. So we are left with 2 units, that is Unit 6, health, and Unit 7, employment. So in today's class, we will be starting with this, we will be discussing these 2 units. So as we all know that Unit 6, health, it is basically the third sustainable goal, sustainable development goal that was adopted in the Paris Environment Summit in 2015. The Paris Summit, and these sustainable development goals are to be achieved by 2030. So the third sustainable goal is ensure healthy lives and well-being for all at all ages. So that we're going to do. The next sustainable development goal is employment. The next unit that we are going to discuss is employment. Now, it has 2 sustainable goals which talk about employment. There are 2 sustainable goals in the list of 17 sustainable goals. There are 2 sustainable development goals which talk about employment. That is the 8th sustainable development goal and the 9th sustainable development goal. So the 8th sustainable development goal is promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. So this is the sustainable development goal 8, which talks about employment, and then sustainable development goal 9 also talks about employment. So sustainable development goal 9 goes like build resilient infrastructure, promote sustained and inclusive industrialization, and foster innovation. So these are the 2 sustainable development goals that talk about employment. So in today's class, we'll discuss health and employment, that is Unit 6 and Unit 7. So let us begin with Unit 6, health, that is Sustainable Development Goal 3. So to lead a healthy life means to make lifestyle choices that complements the physical and mental well-being of an individual. And in fact, managing one's physical health itself is challenging, especially when one is infected with coronavirus disease. So while physical health involves coping with more care and caution, mental health, it strives to adapt to the new normal realities such as work from home, online classes, temporary unemployment, social distancing, etc. So the World Health Organization, in its global campaign to promote mental health amidst the pandemic, has indicated that besides the new realities, people have the fear of contracting the coronavirus and remain anxious about their kith and kin who are particularly vulnerable to the virus. So, as physical and mental health are being affected by the pandemic, it becomes imperative for the social policymakers and also for the members of the community to stay strongly committed in co-creating a people-centered, affordable, and quality health services. So this can be done through the United Nations Sustainable Development Goal 3, which I have discussed in the beginning of today's class, that is ensure healthy lives and well-being for all at all ages that I have discussed. So it is only through this that physical and mental health can be taken care of, and social policymakers as well as members of the community, members of the civil society organizations, they have to take into account the Sustainable Development Goal 3, and all the countries who have signed, who have been signatory to these Sustainable Development Goals in the Paris Summit of 2015. They have certain nationally determined contributions, or intended nationally determined contributions, or INDCs, which are the targets that each country has set for itself to achieve these sustainable development goals. So, in order to improve the mental and physical well-being, social policy makers, community members, and civil society organizations, uh, they should be strongly committed in co-creating a people-centered, affordable, and quality health services through the Sustainable Development Goal 3. So the World Health Organization, in its global campaign to promote mental health amidst the pandemic, it has indicated that besides the new realities, people, they now have the fear of contracting the virus, and they remain anxious about their kith and kin who are particularly vulnerable to the virus. So, despite noteworthy milestones that were made through the Millennium Development Goals, health, in the sector of health, progress has not been uniform across regions and countries. So, for example, Millennium Development Goal 5, it intended to improve material health. And the Millennium Development Goal 5, which intended to improve maternal health, and was successful in reducing the rate of decline in the number of maternal deaths from 523,000 in 1990 to 289,000 in 2030. In fact, globally, the maternal mortality ratio, it had declined by 45%, with most of the cases dropping since 2000. However, significant gaps had occurred due to poverty, gender, disability, geographical location, and ethnicity. Especially inaccessibility and unaffordability to quality healthcare continues to haunt the poor and vulnerable population in our country. So while Millennium Development Goals completed their deadline in 2015, the success and thrust that it has put forth has built a platform for the Sustainable Development Goals. And indeed, the Sustainable Development Goals, they embrace with more opportunity and aspirations for a sustainable and dignified life. So, for achieving this agenda, there are a host of challenges that are lying ahead, especially in the developing countries like India. So, the challenges, they include communicable and non-communicable diseases, skilled human resources, and leveraging financial investments in affordable healthcare. So, in this unit today, we shall discuss the goals and opportunities that are set by Sustainable Development Goal 3, that is, ensure healthy lives and well being for all at all ages in the context of the Indian health policy. So, as we all know, before discussing the right to health and sustainable development goals, I would like to discuss what the Indian Constitution talks about health. So, we have in the directive principles of state policy of our Constitution, in the part 4 of our Constitution, we have Article 4, which puts we have Article 47 in the directive principles of state policy, that is part 4 of the Constitution. We have Article 47, which puts a responsibility on the state to improve the level of healthcare as well as nutrition of the citizens, and also to prohibit the consumption of intoxicating substances except for medicinal purposes. So this Sustainable Development Goal 40, this directive principles of state policy that is enshrined in Article 47 of the Constitution of our country, it talks about the healthy lives and well-being, as well as puts a responsibility on the state to improve the health of the citizens and improve the healthcare apparatus in the country, as well as to improve the nutrition levels as well, which is definitely related to health of the citizens. And it also talks about the prohibition of intoxicating substances except for medicinal purposes. So there is another sustainable development goal that talks about health. It is Article 41. So Article 41, it puts a responsibility of it talks about basically public assistance, right to work, education, and public assistance in the case of if a certain person is not well, if a certain person is in a his or her health is not well, or is suffering from some sort of physical or mental handicap, then that person is entitled to public assistance from the state. It is the responsibility of the state to provide public assistance to that person. So it talks about right to health as well. However, right to health was not originally in the fundamental rights as such, but it was in the 1997 Bandhua Mukti Morcha case that the Supreme Court said that right to health is also a part of Article 21, which is right to life and personal liberty. So the Supreme Court said that right to life, it is not only just living like animals. No, it is right to life with dignity. It's not just staying alive. Rather, it is living with dignity. So it includes right to health as well. So the Bandhua Mukti Morcha case of 1997, in that case, the Supreme Court said that right to health is also a part of the right to life and personal liberty. That is Article 21. And also in 1991, in the Subhash Kumar versus State of Bihar case, the Bihar High Court had said that the Supreme Court itself had said that right to a clean environment, right to clean air, right to clean environment is also a part of the Article 21, that is right to life and personal liberty, which is a fundamental right enshrined in the Constitution. So clean environment and clean air, they are also very much linked with health, with healthy lives. So we have another sustainable development goal, that is Sustainable Development Goal 2, which is end hunger in all its end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. So this sustainable development goal is also related to the right to health. So now we have three sustainable development goals. So we have basically two sustainable development goals, that is Sustainable Development Goal 3 and Sustainable Development Goal 2, which talk about health. So now if we talk about right to health and sustainable development goals, we also have to declare the article, we also have to discuss the Article 25 of the Universal Declaration of Human Rights, which says that it is the responsibility of the state to improve the facilities of healthcare and to provide basic healthcare to all its citizens. So India is also a signatory of the Universal Declaration of Human Rights of 1948, and its Article 25, it talks about healthcare and improving healthcare. And it says that the Article 25 of the Universal Declaration of Human Rights, it says that right to health is a basic fundamental human right of every citizen. and the state should ensure it. So there are many countries which have formulated certain policies also. For example, there is the NHS in Britain, which is there to ensure basic health care. In USA, there was the Obamacare. Okay, in India we have the Ayushman Bharat. All these are to ensure the healthy lives and well-being of the most vulnerable citizens of these countries. So now if we talk about right to health and sustainable development goals, so with right to health being a fundamental human right and a key parameter for measuring sustainable development, the broad goal of Sustainable Development 3 is to ensure healthy lives and promote well-being for all at all ages. So one of the strong commitments of Sustainable Development Goal 3 is to put an end to AIDS, tuberculosis, malaria, and other such diseases. So this goal was set in the global context that poor and inadequate healthcare, it threatens the lives of the rights of women, children, and men, especially from poverty-ridden regions. So, in other words, one's health is affected because of poverty and in turn affects other facets of sustainable development, such as water and sanitation, gender equality, climate change, and peace and stability. So, for almost all the other 16 sustainable development goals, they are also related to health, and their achievement will contribute to health indirectly. For example, there is another sustainable development goal that is related to health, that is Sustainable Development Goal 6, that is ensure availability and sustainable management of water and sanitation for all. That is also linked with health. And also, Sustainable Development Goal 13 is also linked with health, that is take urgent steps to combat climate change and its impacts. So climate change is also a phenomena which is affecting the health of people. So recently, the heat waves that hit India, especially North India, that led to the deterioration of the health of many individuals. So climate change, the rising levels of sea, and the change in the weather patterns, they are also very much linked to the health of the people. Also, our Sustainable Development Goal 10, which talks about reduce inequalities within and among countries. So, reducing inequality will also go a long way in making the people self-sufficient in taking care of their own health. So, almost all the Sustainable Development Goals. So, for example, Sustainable Development Goal 5, that is ensure gender justice and empower all women and girls. So when we talk about maternal mortality ratio, women empowerment, it also comes into the question. When we talk about reducing the infant mortality ratio, there also the question of gender justice and women empowerment is very important. So if women are empowered, then these maternal mortality ratios and women infant mortality ratios can be reduced as well. So Sustainable Development Goal 5 is also there in the picture. So almost all the Sustainable Development Goals, for example, Sustainable Development Goal 1, end poverty in all its forms everywhere. That also, if poverty is reduced, then healthcare will automatically improve. For example, Sustainable Development Goal 4, which talks about ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. So Sustainable Development Goal 4, if the education levels, if the literacy levels of the citizens of the world are increased, then definitely they will become more aware about their own health care, about the health of the community, well-being of the community. So that will also lead to an improvement in the health and well-being of the people. So almost all other sustainable development goals, they are related to health and their achievement will contribute to health indirectly. Although Millennium Development Goals were able to make notable development in terms of halving the child mortality rate as well as the maternal mortality rate fighting against tuberculosis and malaria, etc. In fact, significant challenges continue to haunt the forthcoming years vis-a-vis malnourishment among millions of children and adults, inaccessibility to quality medicines. This is a huge challenge. Malnourishment being a huge challenge, the stunting of children, the wasting of children. These are huge challenges that confront our own country as well. So malnourishment, the stunting of children, the wasting of children, children being underweight. So that is a huge challenge that needs to be tackled, as well as inaccessibility to quality medicine. So all these were revealed by the National Family Health Survey 5, which was recently conducted. The lack of access to women on sexual and reproductive health care, the number of AIDS cases that occur each day. So all these are significant challenges that are there. And in addition to these new health challenges and risks posed by COVID 19, like long term effects on brain, heart, lungs, they threaten the livelihoods in both the developed and developing countries. And in this regard, one of the pertinent questions that arise is that what will Sustainable Development Goals on health is likely to do for the deprived sections of the society by 2030. So, what will these Sustainable Development Goals that are there on healthcare? What are they going to do for the deprived sections of the society by 2030? Because the deprived sections of the society, they are the most vulnerable when it comes to healthcare. They are the most vulnerable. So, what will these Sustainable Development Goals do about them? That remains to be seen. Because these Sustainable Development Goals are to be achieved by 2030. So, the Sustainable Development Goal 3 is linked to human rights of the deprived sections as well. As I've talked about Article 25 of the Universal Declaration of Human Rights, which basically talks about improving the health care of the people, and which basically places a responsibility on the state on improving the healthcare facilities. So, achieving Sustainable Development Goal 3 depends on its linkages with other Sustainable Development Goal targets. So, now let us talk about the National Nutrition Mission or the Poshan Abhiyan. So, recently, the National Institution for Transforming India, Niti Aayog, it released this report, which is Accelerating Progress on Nutrition in India. What will it take? So this is the third progress report on the National Nutrition Mission or the Poshan Abhiyan. So the initial reports, that is 1 and 2, they focused majorly on the mission's preparedness and implementation by the states and union territories. So launched in 2018, this National Nutrition Mission or Poshan Abhiyan is the Government of India's flagship program to improve nutritional outcomes for children, pregnant women and lactating mothers. So it is backed by a national nutrition strategy prepared by the Niti Aayog with the goal of attaining Kuposhan Mukt Bharat or malnutrition free India by 2022. So this is because more than a third of children under 5 they suffer from stunting and wasting, and 40% of children between 1 and 4 they're anemic, they suffer from anemia. Also, over 50% of pregnant and non-pregnant women were found to be anemic, according to the National Family Health Survey or NFHS 4, released in 2016. So, we have done the 6th unit of this paper pertaining to health. Now, let us move on to the 7th unit of this paper, which is pertaining to employment. Employment is basically Sustainable Development Goal 8 and Sustainable Development Goal 9. So, Sustainable Development Goal 8, it says that promote sustained and inclusive economic growth, full and productive employment, and decent work for all. So, it places a responsibility upon states to not only promote sustained, inclusive, and sustainable economic growth, but also to promote full and productive employment and to provide decent work for all. Also, Sustainable Development Goal 9, it says build resilient infrastructure, promote sustained and inclusive industrialization. So it says states should promote industrialization, but that should be sustained and inclusive. And also, it talks about fostering innovation, that is research and innovation. And then, so these are the two Sustainable Development Goals. And the Sustainable Development Goal 10 is also related to employment in a way, indirectly. So it talks about reducing inequalities within and among countries. So also in our constitution, if we talk about our country, India, in our constitution also, there are several articles which talk about employment, especially if we talk about the fundamental rights. Then Article 16 is there, which is equality in matters of employment and in matters of opportunity. So equality of opportunity, which is enshrined in Article 16, which is a fundamental right. And as part of this article only, Article 16, equality of opportunity, certain special provisions have been made. Certain affirmative action policies have been enshrined here for empowering the vulnerable sections, the scheduled castes, the scheduled tribes, and the socially and economically backward castes of the country. For them, certain special provisions have also been made, and also for the economically weaker sections as well, through the 103rd Amendment Act. And also in our country, through the 77th Amendment Act, we had a reservation in the promotions as well. And so this is one fundamental right which talks about equality of opportunity in matters of employment. We also have certain directive principles. For example, we have the directive principle that is enshrined in Article 39, which talks about equal wage for both men and women, and which says that no citizen, because of old age or sickness, should be forced to enter such vocations which are not suited to their age or strength. So also these provisions, they talk about employment. Then there is Article 41, which is right to work, education, and public assistance in certain cases of old age, sickness, or handicap. So right to work is also enshrined here. Although directive principles of state policies given in Part 4 of the Constitution of India are not legally enforceable as per Article 37 of the Constitution, but still they are to act as a guide in the government's policy formulation. So apart from this, we also have Article 42, which is regarding ensuring maternal health and also just and humane treatment of workers, to ensure maternal health and also just and humane treatment of workers. It also talks about maternity leave. So gender justice in employment, which is also enshrined in Article 39, Part A, that is equal wage for equal work for both men and women. And also we have Article 43, which is related to employment only, which is a part of directive principles of state policy in our constitution. So it talks about right to a minimum wage for the workers, and also that the workers should enjoy full opportunities for leisure as well as social and cultural development. And also it puts a responsibility on the state to promote cottage industries either on individual or cooperative basis in the rural areas, so that people do not have to migrate. So this was the vision of Gandhiji also, rural industrialization, smart villages, right? We are building smart cities. So Gandhiji, he talked about smart villages also. So this this directive principle that is enshrined in Article 43 of the Constitution, it says that there should be the workers should get a minimum living wage. So, not only a minimum wage but also a living wage. So, the workers should be entitled to a minimum living wage and full enjoyment of leisure and full opportunities for social and cultural development. And cottage industries should be promoted in rural areas either on individual or cooperative basis. So, these are some of the articles in the constitution of our country which talk about employment. Employment also Article 335 in the Constitution. It talks about it talks about fulfilling the claims of the scheduled castes and the scheduled tribe communities in public employment. So the provision in the constitutions related to employment, they focus on uplifting the vulnerable sections of the society. And Article 45 also puts a responsibility on the state. Article 46, it puts a responsibility on the state to ensure the welfare of the scheduled castes and the scheduled tribe communities by ensuring their representation in the public offices of employment as well as educational institutions. So, if we talk about employment in our country, then we have to talk about the National Rural Employment Guarantee Act, which was brought in 2005, which was later renamed to Mahatma Gandhi National Rural Employment Guarantee Act, and then it was launched as the Mahatma Gandhi National Rural Employment Guarantee Scheme. So this is a labor law in our country, and it is also a social security measure. And what it aims to guarantee is the right to work, that is enshrined directly in Article 41, right to work, education, and public assistance in certain cases. So this act was passed in August 23, 2005. And this act, the Mahatma Gandhi National Rural Employment Guarantee Act, it aims to enhance livelihood security in rural areas by providing at least 120. Now it is 120, before it was 100 days. So it aims to enhance livelihood security in rural areas by providing at least 120 days per household of work per year of wage employment in a financial year to at least one member of every household whose adult members volunteer to do unskilled manual work. So women were guaranteed 1/3 of the jobs made available under the Mahatma Gandhi National Rural Employment Guarantee Act. Rather, it is perhaps the largest and most ambitious social security and public works program in the world. So, the Mahatma Gandhi National Rural Employment Guarantee Act was initiated with the objective of enhancing livelihood and employment security in rural areas by providing at least 100 days of guaranteed wage employment in a financial year to every household whose adult members volunteer to do unskilled manual work. So another aim of the Mahatma Gandhi National Rural Employment Guarantee Act was to create durable assets. What are these durable assets? They include roads, canals, ponds, and wells. So employment was to be provided within 5 kilometers of an applicant's residence, and minimum wages were to be paid. So if work is not provided within 15 days of applying, then applicants, they are entitled to an unemployment allowance. So that is, if the government fails to provide employment, it has to provide certain unemployment allowances to those people. So thus, employment under Mahatma Gandhi National Rural Guarantee Act is a legal entitlement. So if government fails to provide employment, it has to provide unemployment allowance. Thereby, employment under Mahatma Gandhi National Rural Employment Guarantee Act has been made a legal entitlement as it was given in Article 41 of the Constitution. So Mahatma Gandhi National Rural Employment Guarantee Act is to be implemented mainly by the Gram Panchayats of our country. So the involvement of contractors in this is banned. So contractors cannot be involved, and it is to be implemented by the Gram Panchayat itself. and not by any contractor. So, apart from providing economic security and creating rural assets, other things said to promote Mahatma Gandhi National Rural Employment Guarantee Act are that it can help in protecting the environment also in empowering the rural women, which goes a long way in fulfilling Sustainable Development Goal 5, that is, ensure gender justice and empower all women and girls. Also, in reducing rural urban migration and also in fostering social equity among others. So, protecting the environment, empowering rural women, reducing rural urban migration, and also fostering social equity. These are some of the achievements that these are some of the things aside besides creating rural assets and besides providing economic security to the villagers. These are some of the things that the Mahatma Gandhi National Rural Employment Guarantee Act aims to achieve. So the law stated providing many safeguards to promote its effective management and implementation. So this act, the Mahatma Gandhi National Rural Employment Guarantee Act, it explicitly mentions the principles and agencies for implementation. Also, it mentions the list of allowed works as well as the financing pattern, the monitoring and evaluation, and detailed measures to ensure transparency and accountability. And also to tackle the challenges of corruption. And also it says that the funds that are made available, they should be utilized properly. Now let us discuss the constitutional framework of the Mahatma Gandhi National Rural Employment Guarantee Act. So the act, it aims to follow the directive principles of state policies enunciated in Part 4 of the Constitution of India. We have already discussed that. Article 41, which talks about right to work, education, and public assistance in certain cases, and Article 43, which talks about right to a minimum living wage of the workers and full enjoyment of leisure as well as social and cultural opportunities by the workers, and promotion of cottage industries in the rural areas either on individual or collective basis. And also Article 42A, which talks about the ensuring the participation of workers in the management of industries. So the act, it aims to follow the directive principles of state policies that are enunciated in Part 4 of the Constitution of India. So the law, by providing a right to work, is consistent with Article 41 that directs the state to secure to all citizens the right to work. So this statute also seeks to protect the environment through rural works, which is consistent with Article 48A of the Constitution that directs the state to protect and improve the natural environment, including forests, lakes, rivers, and wildlife. And also, it is consistent with Article 51A, Clause G, which is which is basically a fundamental duty. Article 51A, Clause G, which is the seventh fundamental duty in our Constitution. It talks about to protect and improve the natural environment, including forests, lakes, rivers, and wildlife, and to have compassion for all living creatures. So this law, it also seeks to protect the environment as well through rural works, and hence it seeks to uphold Article 48A as well as Article 51A, Clause G. So in accordance with Article 21 of the Constitution of India that guarantees right to life with dignity to every citizen of India, so this Mahatma Gandhi National Rural Employment Guarantee Act, it imparts dignity to the rural people through an assurance of livelihood security. So livelihood is also a very important aspect, and the Supreme Court said that the right to livelihood is also a part of fundamental right, Article 21, that is right to life and personal liberty. The Supreme Court said this in the 1985 Olga Tellis versus Bombay Municipal Corporation case. So the fundamental right enshrined in Article 16 of the Constitution of India, it guarantees equality of opportunity in matters of public employment, and it prevents the state from discriminating against anyone in matters of employment on the grounds only of religion, race, caste, sex, descent, place of birth, place of residence, or any of them. But the state is entitled to make certain provisions for uplifting the vulnerable sections of the society. So the state, the center, and the state, it has to make certain welfare schemes for vulnerable sections of the society by the center and the states. And also there are certain mechanisms, laws, institutions, and bodies constituted for the protection and betterment of these vulnerable sections. So through the First Amendment Act, the government, it said that for ensuring socio-economic justice and social justice and promoting the principle of social equity and affirmative action. So for that, the state can make certain special provisions for the vulnerable sections of the society. Thereby, it overruled the Supreme Court's decision in the Champakam Dorai Rajan case. So the Manrega, or the Mahatma Gandhi National Rural Employment Guarantee Act, it also follows Article 46 that requires the state to promote the interest of and work for the economic uplift of the scheduled caste community and the scheduled tribe community, and to protect them from discrimination and exploitation. So Article 40, it is also it also upholds the spirit of Article 40, which is a Gandhian directive principles in our constitution, which is about organizing village panchayats. So Mahatma Gandhiji, he considered villages as self-sufficient republics. So he said that India is a collection of village republics, and the village was at the center of his oceanic theory of oceanic circles that he gave. And Swaraj, according to him, could be achieved through empowerment of the village only. So Article 40, in tune of that with this principle of Gandhiji, we have Article 40 in the Directive Principles of State Policy, which mandates the state to organize village panchayats and endow those village panchayats with such powers and authority as may be necessary to enable them to function as units of self-government. So for that purpose, the 73rd Amendment, Constitutional Amendment Act, was enacted in 1992, and which has created a three-tier panchayat system in our country, with the Zilla Parishad at the top, the Panchayat Samiti being the intermediary, and the village panchayat or the Gram Sabha being the bottom of this pyramid. And it has also created the State Election Commission to conduct elections to the panchayats, and also 1/3 of the seats are reserved for women in these panchayats, and there are seats reserved for the scheduled caste and scheduled tribe communities in proportion to their population as well in these panchayats. And the State Finance Commission has also been constituted by this article to ensure financial autonomy of the panchayats. And the State Finance Commission, they present reports, and those reports have to be tabled in the State Legislative Assembly, which are regarding the financial condition of the village panchayats. And so these are the provisions to implement Article 40. And so we finally have a three-tier panchayat, which was suggested by the Balwant Rai Mehta Committee in 1957. Although the succeeding committees like the Ashok Mehta Committee, it has suggested a two-tier panchayat, or the LM Singhvi Committee. But we have created a three-tier panchayat structure, and it is provided in the 11th schedule of the Constitution, the list of functions, that is the 29 items which are to be provided to the panchayats. They are given in the 11th schedule, which was added by the 73rd constitutional amendment. It also added part 9 of the constitution pertaining to panchayats. And also in 1996, the Panchayat Extension to Scheduled Areas Act was enacted, and this act was to promote local governance in the 5th scheduled tribal areas. And this act has led to an increase of 3% in the tree canopies in these areas. So we see that the promotion of local governance at the rural level, that has also improved the environmental, that has also enhanced the environment, the condition of the environment as well, right? Thereby fulfilling Article 48A also. That has also led to protection and betterment of the natural environment as well. As we can see that the Panchayat Extension to Scheduled Areas Act has led to an increase of 3% in the tree canopies in those areas. So we have all these provisions in the constitution. And Article 40, which mandates the state to organize village panchayats and endow them with such powers and authority as may be necessary to enable them to function as units of self-government. So conferring the primary responsibility of implementation on Gram Panchayats, the Mahatma Gandhi National Rural Employment Guarantee Act, it adheres to this constitutional principle that is enshrined in Article 40, which talks about creating villages as units of self-government, which is in line with Gandhiji's vision, because the village was at the center of his theory of oceanic concentric circles. And he considered India to be a collection of village republics. Thereby, he wanted to make the villages sustainable, self-sustainable, and he wanted to create smart villages and promote rural industrialization through cottage industries. Also, the process of decentralization that was initiated by the 73rd Constitutional Amendment to the Constitution of India, which was called the Second Democratic Upsurge also. And this it granted a constitutional status to the panchayats, the 73rd Constitutional Amendment, by inserting Part 9 and Schedule 11 to the Constitution. And further reinforced, so this amendment and its provisions, they were further reinforced by the Mahatma Gandhi National Rural Employment Guarantee Act, that endowed these rural self-government institutions with authority to implement the law. Now let us talk about evolution. So since 1960, 30 years were expended in struggling to find suitable employment schemes in India's vast rural hinterland. So before 1960, there was the National Extension Service, which came into force on the recommendations of the Balwant Rai Mehta Committee, which was again aimed at promoting rural industrialization. So the experiences of these decades, the 30 years that were expended in the struggle to find suitable employment schemes in India's vast rural hinterland, the experiences of these decades, they provided important lessons to the government. So these included the Rural Manpower Program, which exposed the tribulations of financial management, the crash scheme for rural employment, on planning for outcomes. Also, it included a pilot intensive rural employment program of labor intensive works. Also, the drought prone area program of integrated rural development. There was also the marginal farmers and agricultural laborer schemes, which was aimed at rural economic development. Also, the Food for Work program was also there, which was aimed at holistic development and better coordination with the states. Also, the National Rural Employment Program, which aimed at community development, and the Rural Landless Employment Guarantee Program, which had a focus on landless households. So in these 3 decades, 1960 to 1990, before the enactment of the 73rd Constitutional Amendment in 1992, these were the schemes which were tried out by the government to find suitable employment schemes for the rural hinterland. And these schemes that we've just discussed, they provided important lessons to the government. And learning from these lessons, the Mahatma Gandhi National Rural Employment Guarantee Act was enacted. So the erstwhile Planning Commission, the predecessor of the Niti Aayog, it later approved the mentioned scheme and it was adopted on a national scale. So on the 1st April 1989, to converge employment generation, infrastructure development, as well as food security in the rural areas, the Government of India had integrated the National Rural Employment Program, or NREG, as well as the Rural Landless Employment Guarantee Program into a new scheme which was called the Jawahar Rozgar Yojana. So this Jawahar Rozgar Yojana, it basically integrated the National Rural Employment Program and the Rural Landless Employment Guarantee Program, and its aim was employment generation, infrastructure development, and food security in the rural areas. So the most significant change was the decentralization of implementation by involving the local people through Panchayati Raj institutions that could lead to a limited role of bureaucracy. So the aim was to limit the role of the bureaucracy and involve the people themselves, the local people themselves, through the Panchayati Raj institutions like the Gram Sabha and the Gram Panchayat, the Panchayat Samitis and the Zilla Parishads, to promote decentralization. So on the 1st of April 1999, the Jawahar Rozgar Yojana was revamped and it was renamed to the Jawahar Gram Samriddhi Yojana, and the objective was the same. So the role of the Panchayati Raj institutions was further reinforced with the local self-government at the village level called the village panchayats, and these village panchayats, they were made the sole implementing authorities. 5th of September 2001, to converge employment generation, infrastructure development, and food security, so in the rural areas, to converge employment generation, infrastructure development, and food security, on 25 September 2001, the Government of India integrated the Employment Assurance Scheme and Jawahar Gramin Samriddhi Yojana into a new scheme, which was called the Sampurn Gramin Rozgar Yojana. And the role of the Panchayati Raj institutions was retained with the village panchayats, who were made as the sole implementing authorities. And yet again, due to the implementation issues that this Sampurn Gramin Rozgar Yojana faced, it was merged with the Mahatma Gandhi National Rural Employment Guarantee Act in 2006. So now let us discuss the main provisions of the Mahatma Gandhi National Rural Employment Program. So at the national level, the registration process, it involves an application to the Gram Panchayat and the issue of job cards. So at the national level, the registration process, it involves an application to the Gram Panchayat and the issue of job cards. The wage employment, it must be provided within 15 days of the date of application. So the work entitlement of 120 days, which was earlier 100 days, per household per year, it can be shared between different adult members of the same household. So the law also lists permittable works. So what are permittable works? Water conservation and water harvesting, drought proofing, including afforestation, irrigation works, restoration of traditional water bodies, land development works, flood control works, rural connectivity, improving rural connectivity, and other works notified by the government. So the Act, it sets a minimum limit to the wage material ratio as 60 is to 40. So the provision of accredited engineers, work site facilities, and a weekly report on work sites is also mandated by the Act. And furthermore, the Act, it sets a minimum limit to the wages which are to be paid with gender equality, thereby upholding the spirit of Article 39, Clause A, which talks about providing equal wage for equal work to both men and women. So this Act, it sets a minimum age to the limit to the wages, therefore upholding the spirit of Article 43, that is, right to a minimum living wage, to be paid with gender equality either on a time rate basis or on a piece rate basis. So the states, they are required to evolve a set of norms for the measurement of works and the schedule of rates as well. So unemployment allowance must be paid if the work is not provided within the statutory limit of 15 days. So the law regarding Mahatma Gandhi National Rural Employment Guarantee Act, it stipulates Gram Panchayats to have a single bank account for Manrega works, for Mahatma Gandhi National Rural Employment Guarantee Act works. The law stipulates that Gram Panchayats, they should have a single bank account which shall be subjected to public scrutiny. So to promote transparency and accountability, the Mahatma Gandhi National Rural Employment Guarantee Act, it mandates monthly squaring of accounts. So to ensure public accountability through public vigilance, the Mahatma Gandhi National Rural Employment Guarantee Act designates social audits as key to its implementation. So social audits are also very important. So for evaluation of outcomes, the law also requires management of data and maintenance of records like registers related to employment, job cards, assets, muster rolls, and complaints by the implementing agencies at the block as well as the state levels. So the legislation, it specifies the role of the state in ensuring transparency and accountability through upholding the right to information and disclosing information proactively, as well as preparation of annual reports by the Central Employment Guarantee Council for the Parliament and State Employment Guarantee Councils for the state legislatures, undertaking mandatory financial audits by each district along with physical audit as well, taking action on audit reports, developing a citizens charter, and establishing vigilance and monitoring committees, as well as developing a grievance redressal system. So the Mahatma Gandhi National Rural Employment Guarantee Act, it recommends establishment of technical resource support groups at district, state, and central levels, and active use of information communication and technology like creation of a monitoring and information system MIS and a Mahatma Gandhi National Rural Employment Guarantee Act website as well, to assure quality in implementation of Mahatma Gandhi National Rural Employment Guarantee Act through technical support. And also it provides for the provision of social audit. So civil society organizations and non-government organizations, political representatives, civil servants, and workers of Rajasthan, Andhra Pradesh, they collectively organize social audits to prevent corruption under the Mahatma Gandhi National Rural Employment Guarantee Act. So as corruption is attributed to the secrecy in governance, the Jan Sunwai or public hearing and the Right to Information Act, which was enacted in 2005, they are used to fight this secrecy. So this is the process of social audit. RTI plus public hearing leads to social audit. So these were the provisions of the Mahatma Gandhi National Rural Employment Guarantee Act. So thank you everyone for joining today's class. Namaste.